Have you ever been on a waiting list? I mean a waiting list that could determine the longevity of your life or shorten it. It's usually a time of fear, anxiety, and helplessness. That has been a life of Gladys Nyape since the year 2015 when she was diagnosed with cardiovascular disease.
That's when they told me that you have a heart problem. Your heart is swelling and the blood is not passing properly. Well, the veins are stuck together and that's why you're suffocating and your valve is blocked.
Gladys's life was turned upside down when she was diagnosed with a cardiovascular disease. This is a group of disorders of the heart and blood vessels which cause chest pains, weakness, numb legs, breathlessness, heart palpitations, dizziness, and fatigue. If not treated with this condition, may lead to heart attack or stroke and eventually death. According to the World Health Organization, more than 4 out of the 5 cardiovascular disease-related deaths are due to heart attacks and stroke, and 1/3 of these deaths occur prematurely in people under 70 years of age. The WHO lists cardiovascular diseases as the leading cause of death globally, taking an estimate of 17 million lives each year. With time, Gladys's condition worsened, making her unable to do her daily tasks. She knew she needed help and that she needed it quickly. She tried herbal and traditional remedies, but to no help. She finally sought treatment at Queen Elizabeth Central Hospital, only to be referred to go to India to be operated on. She needed in excess of millions of Kwacha to get to India, which she could not afford to raise. As she struggled to get funds for the trip to India, voila, help came by through a collaborative initiative by Blantyre Adventist Hospital and the Ministry of Health. A group of Indian doctors under the Hearts for Mission International came into the country offering free heart surgeries. And Gladys was lucky to be one of those to be operated on. Relieved, but at the same time, very nervous. Gladys eagerly went for it. And finally, the day she dreaded arrived. Gladys was wheeled into the operating theater, and for 8 hours, a medical team led by experienced cardiologists worked tirelessly to repair her heart. And the operation was successful, a groundbreaking moment for the country.
In the beginning, I was really scared because people say that the operation is very dangerous and you'll never come back alive. But I just believed in my God who lives in heaven.
The surgery was a turning point for Gladys. With a renewed health, she can now go about her daily activities without feeling the burden of cardiovascular disease.
I can now by myself go to the market or go to church without any challenge. But at first, I couldn't walk that distance.
Gladys's sister, who was her guardian, she's relieved that her sister is now well.
When I saw that my sister received help, I felt good because the work that I have been doing for many years in taking care of her is over, and now I can do some personal things that I was unable to do.
16-year-old Patrick Kiwa from Balaka and a 20-year-old Dorothy Bota from Karabay share a similar story to Gladys. In the same year, the two also underwent the same operation and are now feeling rejuvenated.
My heart was hurting, but as soon as I was operated on, my heart stopped hurting.
Everything changed. My body is strong enough, and now I've gone back to school.
The surgery was led by 2 experienced cardiovascular surgeons, Dr. Nam Wang and Dr. Alega Fekaduleta, along with a team of medical professionals from the United States and Kenya. Since the inception of the open heart surgery camps, last year 56 operations have been done, and among them 32 were free open heart surgeries, which currently have 100% successful and recovery rate, as Dr. Alega Fekaduleta explains.
I tell you, it's amazing. So far, 100%. No complication, no infection, no death. And this is remarkably very, very highest achievement, because heart surgery is not a simple undertaking, and it carries a very significant amount of complication.
This groundbreaking achievement marked a significant milestone in the country's medical history, offering hope to millions of people suffering from cardiovascular diseases in sub-Saharan Africa. And CEO for Blantyre Adventist Hospital, Klibley Kasinja, said his facility has plans to building permanent structures specifically for the open heart surgeries.
Remember, right now we are doing camps. That's not sustainable. We want to move into a permanent reality, which means we are going to establish it here and make it happen so that it doesn't have to be biannually as we are doing now. We want it to come and stay.
The coming of the open heart surgeries camps at Blantyre Adventist Hospital has helped the country save millions of Kwacha in referrals to countries outside, besides complementing government efforts of ensuring that people have access to health services related to any illness. Adrian Chikumbe speaks for the Ministry of Health.
Sending patients outside the country, we use a lot of money on one patient, and when we are able to send a patient refer to a private hospital like this one, it means those same resources could be used for more than 3 or 4 patients, and that also cuts on the time to wait on the list to go for external referral. So that's why we are very happy with the development.
Groundbreaking open heart surgery that took place here at Blantyre Adventist Hospital paved the way for millions of people that have been helpless and hopeless in getting this treatment. It does not only give way to Malawians that have been suffering from cardiovascular diseases, but also a general part of Africa. Mercy Zamawa, MBC News, Blantyre.